Tonight, on Legislative Review. Removing medical debt from credit reports. Plus, building more ADUs to address the housing shortage. And healthcare coverage for obesity treatment. All that coming up on Legislative Review. Welcome to Legislative Review, your source for daily highlights in the state legislature. I'm Angela Nolasco.
Nearly 1 in 3 households in Washington has some person struggling with medical debt. And so when families face this debt, they often have to make tough choices like skipping doctor visits, not filling a prescription, or even cutting back on food.
Our Tuesday coverage starts with a push to prohibit the reporting of medical debt to credit agencies. On February 4th, the Senate Law and Justice Committee convened to discuss Senate Bill 5480, which proposes to prohibit healthcare companies and collection agencies from reporting medical debts to credit bureaus. Under the bill, doctors, hospitals, any other healthcare entities, and collection agencies will no longer be allowed to treat medical debt like any other debt in credit reporting. If a medical debt owed for healthcare services gets reported, that debt becomes void, meaning it can no longer be collected. Should the bill pass, it would make medical debt reporting an unfair business practice and a violation of the Consumer Protection Act. The bill also makes a specific effort to expand the definition of medical debt. Medical bills won't just mean bills for doctor's visits. It would include medical equipment like wheelchairs, hospital beds, prosthetics, or breathing machines. If those debts are reported, they would be void too. Proponents say this is about consumer protection, making sure that having medical debt doesn't impact a consumer's credit score. However, critics argue it's against federal law and would skew the accuracy of an individual's ability to pay a loan or a line of credit if their existing creditworthiness doesn't show a complete picture of debts they owe. Democratic Senator Marcus Riccelli sponsored the bill. He said in states where medical debt is removed from credit reports, scores increase by an average of 20 points.
Medical debt differs from other types of debt like student loans or mortgages. No one chooses to get sick or have a medical emergency. Yet unpaid medical bills can still hurt people's credit scores, making it harder to rent an apartment, buy a home, or even get a job. Medical debt is one of the #1 causes of bankruptcy in America. Even with insurance deductibles and copays have been piling up, the cost of treating chronic illness or an emergency room visit can be overwhelming, forcing some into medical debt.
He believes the bill will reduce barriers to housing and help Washingtonians, especially in underserved communities, qualify for better interest rates and access credit they can afford.
We can try to affect and change some of the long-lasting effects of policies that have unfairly harmed some of our communities, our Black communities, Indigenous communities, our Latino communities, leaving them with lower incomes, higher rates of being uninsured, and more medical debt.
The Washington Collectors Association, a trade organization representing the state's credit and collection industry, spoke against the bill.
While medical debt often arises from unforeseen circumstances, it does not eliminate the responsibility to fulfill financial obligations. Collection agencies and creditors already face challenges with consumers prioritizing payments only for debts that appear on their credit. Restricting the ability to collect these obligations has broader consequences, including increased costs for goods and services and financial strain on healthcare providers.
The Northwest Justice Project, a nonprofit providing legal help to low-income communities, spoke in favor of the bill.
The purpose of the credit reporting system is to assess credit risk, not to coerce people to pay debts they may not owe. Many clients have insurance but are underinsured. They come to our clinic having been sued by a debt collector on hospital debt they don't even owe because they qualify for hospital charity care that the hospital has failed to screen them for. If the debt is more than $500, it's going on that consumer's credit report where it sits as a negative entry for 7 years, causing credit ruin, inability to obtain rental housing, and competitive credit terms on any type of loan, car, personal, or mortgage. SB 5480 will prevent this additional credit harm and will have the added benefit of not discouraging people from seeking medical care.
The bill was also opposed by independent healthcare provider Emergency Medicine Associates.
We know healthcare is expensive. We work closely with our hospital to provide the most cost-effective care possible. We respect that lots of patients have financial constraints, and we provide the same comprehensive charity care and discount services as our hospital. We resort to collections and legal measures very rarely, and only after exhaustive measures to ensure that the patient actually has the means to pay their bill.
During the hearing, the Washington State Hospital Association took a neutral stance on Senate Bill 5480 and shared their recommendations with the committee, such as defining and clarifying who the bill will affect, as they claim hospitals make up only a fraction of the healthcare system and not all medical debt comes from the same source.
I think we'll start by opening the public hearing on 1353.
A bill aimed at addressing Washington's housing crisis came before the House Local Government Committee Tuesday. House Bill 1353 proposes a so-called ADU self-certification program, where architects in cities planning under the Growth Management Act would be allowed to independently certify plans for accessory dwelling units that meet code standards, speeding up the approval process and making building ADUs faster and easier. Democratic Representative Alex Ramos sponsored the bill.
The architect on a project can review their own plans and certify that they're in compliance with the building codes and other rules. The goal here is to take some of the workload away from cities and get permits turned around more quickly to help address our housing crisis.
Members of the building industry expressed support for the bill, some even suggesting expanding self-certification to other professionals like structural engineers.
I think this is such a great idea. What we're looking at is an environment where we're trying to speed up construction, speed up the availability of these additional housing units.
House Bill 1353 also received support from the Association of Washington Cities. No one testified against the bill. A new bill proposed in the Senate could change how obesity is treated across the state. Senate Bill 5353, the Diabetes Prevention and Obesity Treatment Act, would require all health plans to treat obesity as a chronic disease and provide comprehensive coverage for treatments beginning 2026. These include healthcare-approved weight loss surgeries, lifestyle treatments, and medications backed by the FDA. It would also require Medicaid to cover these once federal funding is secured, potentially by late 2025. The bill's goal is to ensure that deductibles and copays for obesity are considered like those of other medical conditions. Under the bill, health plans will still be able to review whether the treatments are necessary before approving coverage.
And I would like to open the hearing on Senate Bill 5353.
At a public hearing held by the Senate Health and Long-Term Care Committee Tuesday, Democratic Senator Annette Cleveland spoke on the bill she co-sponsored.
There's no question. We know that obesity is a chronic illness and it can cause other chronic diseases and health concerns and complications. So this bill really looks at the full spectrum of treatment, including intensive health, behavioral and lifestyle treatment, obesity medications, and metabolic and bariatric surgery.
Thank you, Madam Chair and members of the committee. Erin Jajek here for the American Diabetes Association.
Senate Bill 5353 received support from the Washington Diabetes Association.
This is not Ozempic for all. This is the myriad of weight loss interventions that are out there, and all of it contemplates following FDA guidelines. In bringing this forward, we are not talking just about GLP-1s, right? As you've heard, we're talking about generic medicines and bariatric surgery that have been around for a while that are not mandated to be covered in our state.
The Washington State Public Health Association also spoke in favor of the bill, citing a CDC study reporting that 1 in 3 American adults is obese, costing over $173 billion annually.
It's associated with many chronic diseases, a reduced quality of life, more disability, and a reduced life expectancy of about 14 years, which is similar to smoking cigarettes. Sometimes behavior change alone cannot address the problem. Sometimes medical treatment is necessary. There are inequities in who has obesity, with zip code being a big indicator. There are also inequities in who can access this treatment. This bill will help to fix this unequal access for those who need it the most.
The full hearings covered in this episode are available to watch on demand on tvw.org. Thanks for joining us tonight. To watch an entire legislative hearing or floor debate, check out TVW's archives for on-demand viewing at tvw.org.